Good afternoon, everyone, and thanks for joining us for this solution session. Today, we'll be covering Phreesia's COVID-19 vaccine management solution, how to increase patient uptake and reduce vaccine hesitancy. Since Phreesia is a public company, we must remind you of our safe harbor statement. We may share statements about our future plans, products, and features today. These statements are not investment advice. Before we get started, we'd like to thank HealthIMPACT for hosting us and for hosting this great event. We're so pleased to be here. We're going to quickly review what we'll be discussing today. First, we'll do some quick intros. Second, we'll describe Phreesia's COVID-19 vaccine management solution and its components. Third, we'll be discussing how Phreesia is helping providers manage COVID-19 vaccine uptake and addressing vaccine hesitancy. At the end, we'll leave time for audience questions and answers, and we'll get to as many as we can. If we don't get to your question, we'll reach out directly afterwards. So if you have any questions, make sure to ask it at any time during the session. Just type it into the Q&A box that you see at the bottom of your console. Now, let's get to it. I'm Dr. Alicia Cowley. I'm an internist and director of clinical content at Phreesia. Most recently, I was an academic hospitalist at NYU Langone Medical Center in Manhattan. Let me turn it over to Rachel so she can introduce herself as well.
Hi, everyone. My name is Rachel Goldman, and I'm a senior product manager here at Phreesia. I'm specifically responsible for overseeing the strategy and development of our clinical suite of applications. Thanks for having us today.
For those of you who might not be familiar with Phreesia, we're a health tech company focused on patient intake process. We're guided by an overarching mission of creating a better, more engaging healthcare experience for patients, providers, and staff. We've been the top-ranked patient intake management company by the research and insight firm KLAS, and we have integrations with leading PM and EMR systems, including Epic, Cerner, and Meditech. We've been vaccinating for almost 3 months now and hearing about both the successes and the challenges in doing so. It's been a historically complex challenge to ensure that enough vaccines are distributed in an effective, rapid, and equitable way. The US has some experience with mass vaccine distribution to build on, and we've faced some of these challenges before. But if anything is true this year, delivering the COVID-19 vaccine required a much greater scale than past efforts and brings new and unique challenges as well. Some of those key challenges include the ones shown here. There's issues with access due to federal, state, and local roles, racial and ethnic disparities, insurance coverage and out-of-pocket costs, supply, logistics and monitoring, funding for vaccine distribution, as well as communication and trust. Phreesia invested in a vaccine management solution because we recognize that providers are the cornerstone to successful vaccination efforts now and in the months to come. According to a survey conducted by the Kaiser Family Foundation earlier this year, 8 in 10 Americans say they'll turn to healthcare providers when deciding whether to get vaccinated. This is followed, as you can see, by groups such as the CDC, family or friends, state or local public health departments, pharmacists, and religious leaders. What's more striking is also the fact that this breakdown is true across racial and ethnic groups. People trust their providers and they want to hear from them. While we currently find ourselves in a low supply, high demand part of the curve, those variables are going to change over time. As such, Phreesia recognized the need for health systems and FQHCs to be ready to deliver vaccines now, while also preparing for the future when people are looking for access to the vaccine while obtaining routine care with their providers. On that note, Rachel, I'm going to turn it back over to you.
All right, thanks, Dr. Cowley. So I'm excited to introduce Phreesia's COVID-19 vaccine management solution, which we first launched back in December of 2020 to help our clients as they embarked on the most extensive vaccination effort in history. So as you can see, this is an all-encompassing solution. It's designed to help manage all outreach and intake needs. So next, let's take a deeper dive into the components that make up our solution. First off, we can help practices communicate with patients using a multi-channel approach to outreach as well as set up automated reminders and recalls to ensure that patients don't miss their initial appointment or their second dose. We can help you manage your waitlist and scheduling all in one place with a sign-up link that can be put on your website or sent out to a targeted group of patients via text or email. And these waitlists can then be managed based on custom criteria depending on your state's current vaccination guidelines. Phreesia can also help automate the COVID-19 vaccine intake process, including consent form and data collection, screening patients for clinical eligibility, and two-way patient chat to text your patients with day of visit instructions. And the last thing here is that we can help you maximize vaccine uptake and completion with a vaccine hesitancy survey that assesses a patient's vaccine hesitancy and then delivers educational content. So our solution incorporates best practices from healthcare organizations all across the country. It was designed to help you as you prepare for the vaccine, especially right now while supplies are still limited, but then also to hit the ground running once you do have vaccine doses ready for delivery. So next up, we're going to take a closer look at the actual product components available for use, and we'll start with what we can do to help with communicating with patients. So here you can see a sample outreach campaign that we've designed to help educate patients and gather interest in vaccines. So Phreesia has a library of pre-built outreach content, and this was specifically designed by our clinical engagement team to help practices get up and running quickly. However, if you want, practices can also design and create their own custom content too. Our goal really is to help you keep patients up to date on vaccine availability and reduce your inbound call volume. So this slide shows another example of outreach content that was specifically adapted from the CDC for digital engagement. We know that patients are looking to their providers for reassurance, so we want to help you get the word out quickly and to your full patient population. Like I mentioned before, we have a number of turnkey templates that are available for immediate use and that encompass a wide range of different use cases. All right, so next up, we have managing a waitlist and scheduling. So this ties directly back into patient communication, as our best practice is to proactively outreach to those patients that are currently eligible to receive a vaccine. And you can send that outreach both via text message as well as email and include a link within the message to prompt patients to schedule. So sending targeted campaigns like this allows you to control patient scheduling based on your state or local guidelines at any given time. But if you do want to provide kind of a more open option to your patient base or even to your local community, we do have the ability for you to place a link on your website where people can submit vaccination requests. So the vaccine request form that you see on the screen here is fully customizable, but we do recommend collecting basic patient information like the demographics you see here, as well as aligning the available reasons for visit to your scheduling cohorts. So this is going to help your staff later when they're looking to pull patients off the wait list and offer available appointment slots. All right, so now this slide here walks through our recommended process for staff after patients have submitted that vaccination request. All of the requests that you get are going to feed into a centralized waitlist, and that waitlist is easily accessible from the Phreesia dashboard. It can be filtered based on the custom criteria that you've collected on your form, and your staff can also add notes and update statuses really easily, so that way they can see where each patient is at kind of within their scheduling journey. And when you are ready to schedule a specific patient, you can use two-way patient chat to communicate appointment availability. So what we've found is that texting with patients results in much faster response time. All right, so the third component of our vaccine management solution is around automating the vaccine intake process. Let's take a closer look at that one next. So our recommendation is to start out by sending a strong confirmation message to patients up to 48 hours before their scheduled vaccine appointment. So again, as you can see, we have both text and email options available for communication. And by encouraging pre-registration, our goal is to help decrease no-shows and therefore wasted doses in your office. As part of the patient's pre-registration process on Phreesia, we're going to ask them to confirm their demographic information, to sign any necessary consent forms, and also to complete a vaccine screening questionnaire. So the screening questionnaire that we offer is adapted from the CDC, and it screens patients for any potential contraindications that they might have to the vaccine. So this slide just shows you in a little bit more detail what some of those questions actually look like. And as you can see kind of on the right-hand side over here, we do use proprietary logic to intelligently prompt patients any follow-up questions if we need to gather more information from them based on their initial responses. And after the patient is done answering their vaccine screener, we then also present notice screens with specific instructions that are tailored to the patient based on their responses. So if a patient is found to have a contraindication to the COVID-19 vaccine, then we're going to instruct them to call the office to reschedule that appointment, as they shouldn't be getting the vaccine at that time. But in contrast, if they don't have any contraindications, then we're going to provide some instructions around medications and allergies and allow them to proceed with the rest of their intake process. And the very last part of the patient's vaccine intake includes tailored education and then an instructional thank you screen. So the example shown here is the education that we would provide if a patient was registering for their first dose of the COVID-19 vaccine. We do use motivational interviewing techniques to prompt patients to take action in their care. Specifically here, we want to make sure that they're going to schedule that second dose appointment before they leave the office. If instead the patient was filling out their registration for either a second dose appointment or for the 1-dose Johnson & Johnson vaccine, we'd have different educational material on here that talks about vaccine effectiveness and public safety measures that patients should continue to take. So after a patient completes their intake process for their vaccine appointment, we're also going to automatically generate staff-facing notifications on the Phreesia dashboard. So the example that you see here shows the staff notification if a patient screens positive, or in other words, if they were identified as having a contraindication. So this red vial icon is going to appear next to the patient's name. Staff can click on it, and then it'll display all of the patient's answers to the screening questionnaire. This is going to allow your staff to reschedule the patient if necessary, and then provide that open appointment slot to somebody else from the waitlist. And then in contrast, this is the example of what it looks like when the staff notification is negative or the patient does not have any contraindications. So instead, we're going to surface a green vial icon and let you know that that patient has been cleared for vaccination. All right, so the last bucket we have here is around helping to maximize uptake and completion. So Phreesia has partnered with Convince USA to develop a vaccine hesitancy survey in order to better understand and address patients' COVID-19 vaccine hesitancy. So this survey can be sent out to patients both outside of a visit, and it can also be prompted when patients are coming into the office for routine, kind of non-vaccine related visits. For patients who indicate that they are likely to get a vaccine when one's available to them, we'll also ask if they want to be added to your vaccine waitlist if your organization does plan to deliver vaccines either now or in the future. And now we'll take a closer look at this survey. We start with some basic patient education and ask if the patient has received a dose of any COVID-19 vaccine. If they say no, then we allow them to proceed and answer the full survey. So here you can see that we ask kind of some more detailed questions to allow providers to gain a better understanding of their patient sentiment toward the COVID-19 vaccine and really to understand their main concerns. Our research shows that providers are the ones best positioned to combat hesitancy. So what we're going to do is surface up these responses for provider review afterwards and help facilitate further conversation. And the last screen of our survey here instructs the patient to actually talk to their provider about the vaccine, and we're prompting them with some sample questions that they could ask during that conversation. So we are actively working with our research partners to kind of test different versions of this education screen to see which language helps facilitate the most conversations and leads to higher uptake rates. So we've already talked about how patients who indicate interest in the vaccine kind of feed into a centralized waitlist. That's no different if the patient is coming from the hesitancy survey. We still want to keep things as simple for staff as possible. But the new thing you see here is that we do also offer robust analytic tools to help staff analyze survey responses and look at their patient population in aggregate. All right, so that's the end of our vaccine solution overview. Dr. Cowley, I'll turn it back over to you to talk about next steps.
Great. Thanks so much, Rachel. So to help you get started, it's a good idea to take a moment and reflect on your organization's needs and timeline, and think about which of the tools we've described today might be helpful. If you're ready to get started, there are already a few resources that we have available to you today to reflect more on what your needs are. And that includes our COVID-19 vaccine playbook, which is available online. It covers tips as well as successful outreach, scheduling, intake, and hesitancy management that dovetails with each of the tools that we've talked about today. You could also stop by our booth in the virtual exhibit hall and speak with a live Phreesia representative. Finally, you could also request a consultation using the link that our colleague Paulina is going to share in the chat box. We've got a few minutes left, so we're going to take a peek and see if there's any questions coming in from our audience. Paulina, one of our colleagues, is going to help us take a look. While she's pulling up those questions, we want to remind you that there is, again, that Q&A box at the bottom of your console, should anything else come to mind that you want to ask. And I guess, Paulina, just turning it over to you, see what we've got.
Great, thanks, Alicia. So in the Q&A box, this person asked, how long does it take to get started with Phreesia's vaccine management solution? We're receiving a new shipment of vaccine doses next week, so we would need to get up and running fast.
Yeah, so I can take that one, Paulina. Many of our large health systems that we worked with back in December and January needed to get up and running very quickly. It was a matter of days or even a week. So we are able to accommodate very fast turnaround timelines, kind of depending on what pieces of the solution that you'd be looking to use. So if you are interested, we can help kind of put together a custom timeline based on what you're looking for.
Great, thanks, Rachel. Our next attendee, this person put in the chat, do I have to use all the components you mentioned that are part of the vaccine solution? And I'll direct that to you, Alicia.
Okay, that's a good one. Yeah, the good news is you don't have to use all of the components we talked about today. You can pick and choose from each of the tools we discussed, and then furthermore customize them to meet your needs. We have a services team. They'll partner with your organization's team and configure the workflows as you need, as you see fit. And then to make the decision easier, we do have some additional collateral. We have clinical best practices from our clinical team. We have recommendations from our network, because as Rachel mentioned, some health systems have been live since December. So already a few, what worked, what didn't work in those organizations. And we also have a vaccine solution workbook to really outline and make the steps as easy as possible.
Great, thanks, Alicia. It looks like that's all of our questions that we've received. So I will turn it back over to you to wrap us up.
All right, great. As mentioned in the chat box, if you have any other questions, feel free to stop by our virtual booth. And if anything comes up as well, we'll have our email, I believe, here on the next slide, where you can reach out with any questions as well. Thank you again for joining us. Thanks, HealthIMPACT, for inviting us. Rachel, thanks for joining me. And Paulina, you too. And stay safe, stay healthy, and we'll talk soon.
Thank you.